Ladies and gentlemen, hello. I am Dr. Haris, a graduate of dental surgery from Lahore. Now today we'll discuss about the structure of enamel. It's a very simple topic, but it's extremely important, especially for all the dental students. So, enamel is the outer covering of the crown, and it is the toughest and hardest substance in the oral cavity. And not just the oral cavity, but in the whole body. Let me tell you, in case of a plane crash, the forensic specialists identify the dead bodies with the help of teeth. Now, some other facts about enamel are that it does not have its blood supply, it is avascular, neither does it have its nerve supply, it is non-vital, and once it is formed, it cannot be regenerated. Okay, so in this video, whenever I'll talk about inorganic material or crystals or minerals, I mean the same thing. Okay, enamel is composed of 96% minerals, that is hydroxyapatite crystals, and 3 to 4% of organic material and some water. Now, hydroxyapatite is one of the existential forms of calcium and phosphate, and it gives the hardness and the strength to the teeth, to the bones and other calcified structures in the body. Your bones, however, have only 40 to 50% of mineral. The teeth, like I said before, the enamel has 96%. Now it has almost double the strength, the hardness, the toughness as compared to the bones. Now coming to the structure of hydroxyapatite. Hydroxyapatite crystals are basically long and ribbon-like, and their unit cell, as shown in the picture over here, has a hexagonal symmetry. Now these crystals, they stack upon themselves to form cylindrical rods and interrods. And the fundamental structural unit of enamel is the rod. Now, the rods, like I said, the fundamental structural unit of enamel, it spans the entire thickness of enamel. Now, enamel has two borders. The outer border is called the enamel surface, and the inner border is the dentino-enamel junction. And the rods, they span the entire thickness from the enamel surface towards the dentino-enamel junction. Now, in this picture, if you see number 6 and number 8, you can see that the ES represents the enamel surface. That is one end of the enamel rods, and the DEJ represents the dentino-enamel junction, and this is the other extent of enamel and the enamel rods. And interestingly, when viewed in cross-section, the enamels exhibit a keyhole pattern. You can see here in number 7 and number 9 that it's a very beautiful keyhole pattern, but this term was discontinued. And why was that? Because inside the enamel, the rods do not follow a uniform course. At one point they will be keyhole-like, and at the other point they will be arcade-shaped. Okay, so this term was discontinued. Now, in addition to rods, we also have what we call as the interrods. Now, the interrod is structurally and chemically similar to the rods. It is also made of hydroxyapatite crystals. It has the same properties like with the rods, but the only difference comes in their orientation. The direction and the position of the crystals is different from the rods. And the bigger picture of the enamel is that the cylindrical rods are embedded between the interrods. Now, it's important for you to know that because their orientation is different, the place where the rods and the interrods meet, their interface, has a small space, and that space contains organic material inside it, and that region, that space, is known as the rod sheath. It's a very basic concept. Now, I've told you much about the enamel. Now we'll move on towards the clinical aspects of the enamel rods. Now, when in the clinical practice we prepare a tooth, it's essential that we leave a support of dentine below the enamel. It's essential because enamel is extremely hard, but with its hardness, it is brittle. the more hard a material, the more brittle it is. And the brittleness causes the unsupported enamel, the enamel below which there is no support of dentine, to break away. That is why in every preparation of the tooth, be it a filling or any other restoration, there has to be a support of resilient dentine below the enamel rods or the enamel would fracture. Secondly, a very, very important and modern phenomena in modern clinical practice is the concept of acid etching. Now, you all know what is an acid. Okay, acids are corrosive materials, and anything that comes in contact with it becomes damaged. But in this technique, that is acid etching, what we do is that we apply 37% phosphoric acid over the surface of the tooth, over the enamel, and this increases the reactivity of enamel by selective dissolution of crystals. And after acid etching, we can place filling materials such as the composite filling materials, and we can cement the orthodontic bands like in this picture. And lastly, I want all of you to know the most common reason why people visit the dentist, the dental caries. Now, the dental caries is the demineralization of enamel and also the dentine if it spreads. Now, the crystals inside the enamel are susceptible to acid. And which acid? The acid that is produced by the bacteria in the oral cavity. The bacteria use sugars and they ferment acid, and that acid, if present for a long time and improper hygiene of the patient, causes dental caries, which is shown over here. Now, in the beginning of the video, I said that enamel once formed, it cannot be regenerated. And the reason it cannot be regenerated is that the cells that form enamel, the ameloblasts, once after formation of enamel, they undergo cell death, a process called apoptosis, and that is the reason why enamel cannot regenerate, and if damaged, it has to be physically replaced with some sort of filling materials or any other restoration. So this is all about enamel. This is the basic structure of enamel. This is very important. I want you to learn as much of enamel as you can, and if you like this video, please subscribe and give us a thumbs up. Thank you very much.